Can you be healthy at every size? Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation online. This video is going to be a little different. Thanks for sending it. It gets into health and weight and whether there's discrimination against people who are heavy. Certainly there is. And then the idea, though, like you have a loved one who has no idea that being heavy might be harmful. How do you broach that topic, and should you really? A lot of people come to me because their doctors are telling them, you need to do something about your weight. Why would they say something like that? Be sure to wait till the end where I give my final thoughts. Before we dive into today's video, I want to invite you to my free webinar, Beyond Cholesterol, the 2 biggest risk factors for cardiovascular disease. If you're confused by cholesterol or feeling pressured by your doctor to take cholesterol medication, this webinar is perfect for you. Discover the crucial facts about why cholesterol isn't the primary concern for cardiovascular disease risk, and learn what you should focus on instead to evaluate and lower your risk. You can sign up below.
Whenever I mention the word health at every size to somebody, more often than not, I am immediately slammed back with one of the common misconceptions about health at every size. And so in today's video, I'm going to be breaking down 7 misconceptions of health at every size so that you actually know what this whole approach is about and if it's something that you can apply to yourself. And if anything, I just hope that I can dispel all of these misconceptions so that it can be something that's more encouraging to you. On this channel, you will learn the science behind why you overeat, as well as the whole approach of health at every size and how you can apply it to your life. You'll learn tangible take-home strategies that you can use to improve your relationship with food and your body. Now, if this sounds like just what you need, subscribe to the channel and hit the bell in the top right corner so you don't miss a video. I publish every Wednesday. I'm Meredith McKenzie of Parallel Wellness. I'm a registered clinical counselor and intuitive eating coach, and I've helped hundreds of women to repair their relationship with food in their bodies so that they're more attuned to their hunger and fullness cues. They're actually moving their bodies in ways that feels good and nourishing for them, and they're able to leave diet culture behind and live their best lives. The first misconception that I'm going to cover is probably the biggest and the one that I hear the most frequent, and that is that taking a health at every size approach is really only promoting people staying fat and staying unhealthy. Now, to clear this up, the first thing we need to get clear on is that health at every size is actually about ending weight discrimination. And weight discrimination is this idea that we have internalized for both ourselves and how we judge other people, that people in larger bodies are less than, that they are, all these other negative things that we relate with being in a larger body or being fat.
Yeah, and I totally agree. In fact, in the obesity medicine world, we often muse that the last place where it's socially acceptable still to discriminate is upon weight. You can't based on race and religion in theory, and yet we still see people passing judgment, making snap judgments based on someone's weight. You can be very in tune to where someone's looking, and if someone's looking at you and looking at your weight, you're going to be very in tune to that and sensitized. But sure, there's still a lot of discrimination and snap judgments about someone who's overweight, and that's too bad. That I totally agree with her that this is not right. It's not appropriate.
And that if you were in a smaller body, or if you're closer to that thin ideal that our society upholds, that you are a better person for all these other reasons, which we need to recognize, and this is really what health at every size promotes, that that's complete garbage, that personal characteristics do not come down to the body weight or size of your body, and that there's so much more that contributes to why a person lives in a larger body, and it's not about their value as a human being. So that's just the first thing that we need to be clear on.
Yeah, and it's not just other people passing judgment. I've seen people pass judgment upon themselves. And there are generational differences for sure. And I even remember meeting someone who I think was in the 20s and really didn't understand that they were heavy. in fact, it was a shock when the doctor told her that, you might want to work on your weight and get that down for various reasons, because she was raised in a society now, and in classrooms and friends who were all heavy. And, that is fine if there's no health consequence of it. But when the doctor, said, here's why I want you to lose weight, and then she ended up in my office, it was a bit of a shock because she didn't know that it was a possible problem.
The other important factor that Health at Every Size really works on promoting and providing education on is that the way the medical industry has traditionally approached weight can actually be quite damaging and harmful for people because it's actually not based in true science. And that is that these arbitrary ideas for ideal weights and expectations of what weight should be are not actually based in science. For one, body mass index, and this is going to be a whole video on its own, but body mass index is really just an error waiting to happen when we consider, how we evaluate people's body sizes based on their weight versus their height. And so again, like I said, I'll put this in a future video when we talk about BMI, but the different scales that we use in that way in the medical field aren't accurate, and they aren't a true representation of a person's health.
Well, I'm going to take issue with that a little bit, just depending on the context. She's right. I mean, if you're at the gym, for example, where the weight might be muscle mass, then the BMI does not apply. And it's going to be skewed to make someone look like they're obese when they're not. Obesity really is excessive fat mass. It's not just a higher BMI. In my clinic, so in a referral clinic, an obesity medicine clinic that I work in at Duke University, the BMI is actually a very good indicator of excessive fat mass because very few people have gone to the gym and have mostly muscle on their body. So depending on the context, BMI can actually be useful to get sort of in the ballpark of whether this is a concern, but yeah, it's not perfect. The interesting thing though, when we start looking at risk and look at populations, there's an excellent study that followed women over 10, 20 years, and BMI did register as a risk factor for heart disease. And so there is a component of BMI that does confer a little bit of heart disease risk. Now, it's nowhere near smoking, it's nowhere near high blood pressure, it's nowhere near diabetes, but it's on the level of, well, like an LDL cholesterol level of concern. So a doctor is going to be flagging something with that level of concern because that's the way we're taught. But the BMI can actually be a useful tool as long as you're not at the gym in mostly muscle.
Along with this, just looking at a person on the outside and what their body shape and size looks like, or the weight that they are, doesn't determine how healthy that person is. There are all kinds of reasons why somebody's body might be the weight and size that it is, and they might have nothing to do with the health behaviors that they engage in. They could be eating, all of the foods that we would typically recommend to promote your health. They could be moving their body regularly, getting lots of sleep, not drinking or smoking, all of those things that we consider, health behaviors. And yet, genetically, they are predisposed to being in a larger body. And so it's really damaging to people's well-being when we make these judgments about them and assume, just by looking at them, that they are unhealthy or that they are healthy because they are in a smaller body. And again, we then cut out a whole portion of our community who might actually need some health interventions, but because they're in a smaller body, we just assume that they are doing all the right things.
Yeah, so the way someone looks on the outside, it doesn't tell you how the metabolism is on the inside. So you might be heavy and not have diabetes or not have metabolic syndrome or any other sort of metabolic risk factor. Conversely, you might be skinny on the outside and have type 2 diabetes, or you might be a smoker. So the idea of snap judgment, someone's large, they're unhealthy, I totally understand. But there is a little bit of risk. Now, not just the heart disease risk, there are what called the fat mass, the idea that you're carrying around extra weight can lead to joint deterioration and problems, but that takes a long period of time for that to develop. But it's important to have someone understand that, so that you're at a higher risk of having a knee replacement as you get older if you're carrying around more weight. In fact, I get a lot of referrals from the orthopedic surgeons who want to do knee and hip replacements, but they want the patient to slim down, to lose weight before getting the operations for several reasons. One is that wear and tear on the joint, and also they tend to do better during the hospitalization and after the hospitalization if they've already lost some weight and if they're eating a healthy diet.
Now, along with this misconception, and I think it's very important to point out, because this is, again, where people really try to knock health at every size, is that by no means does health at every size say that the size or the body shape that you are currently in is necessarily healthy for you. It is very possible that because of overeating or emotional things that are going on for you, or things that are happening in your life economically or societally, that you are living in a larger body, and that it would be healthier for you to be in a smaller body if you were to engage in different health behaviors and have some improvements in some of these other factors that impact your health. So that is also an important thing to remember, that it's just not a blanket statement of, just love your body that you're in and everything's fine. There is an encouragement to engage in more healthful behaviors. So it's actually a really critical piece of truly understanding the health at every size approach, to recognize that when we remove this focus on weight, we're not also saying that health behaviors and, living a healthy lifestyle are not important. That's absolutely not true. We're just saying that the weight bias is really tripping us up and not a good fit at all for encouraging people to live healthful lives. And instead, let's move these other things to the forefront.
Well, the traditional approach might not be working for someone who's heavy, who is happy where they are, but they want to make some changes. And so if you have been trying things and those things aren't working, be sure to move on. Move on to different types of eating patterns. And if you're trying to address the weight and lose the fat mass, you want to target the idea of getting your fat on your body to burn. And you can do that by reducing calories. You can reduce carbs, and so your body has to start burning its own fat. That's the method that I like to use. And it's important to know that you don't have to exercise to lose weight if you're wanting to lose weight. Or it's, the underlying theme here of being happy with who you are is so important. I mean, that's true for everyone, regardless of the weight. And the idea here is to take the weight out of the forefront of the discussion. I think this is great.
The second misconception is very similar to the first, but rather than just focusing on staying fat and staying unhealthy, it's this assumption that people who follow a health at every size approach believe that being in a fat or overweight or larger body is healthy. And again, I want to go back to the fact that the research shows that being in a larger body does not necessarily mean that you are unhealthy. There's nothing to say that exactly weight correlates with negative health. And so that's something that's really important. And I will be doing a video in the future on all of that data and research so that you have access to it. We know that there are people in all different shapes and sizes that are unhealthy. And so weight alone does not determine whether or not somebody is healthy. And so yes, health at every size is not focused on weight loss specifically or encouraging people to lose weight. Instead, it's focused more on increasing access that people have to, a better quality of life that enables them to have a better quality of health as well, and promoting healthful behaviors while taking away that discrimination about weight.
Yeah, so that's great. The weight discrimination is rampant. Still, it's kind of the last vestige of socially acceptable kind of bias. And I think that helping people to get through that and help reducing that societal stigma and societal discrimination is a great idea.
The third misconception about health at every size is it's just another social justice movement. And while yes, it is congruent with the social justice movements and anti-discrimination against weight bias, absolutely, it is actually so much more than that. It's very much based in these principles and science and really trying to correct the medical community and how we provide care for individuals so that we can be more inclusive and actually promote health in a realistic way that's based on science, not based on assumptions and this discrimination that has got it wrong for so long. If anything, it's trying to correct something that has gone wrong in our system for far too long. So as we're going through these misconceptions, I'm sure you're having some questions yourself and maybe even thinking about things differently and wondering, well, what about that? So if you have something that you're curious about and wondering if it might be a misconception that you have, or if there's any validity or credibility to it, let me know. Leave a comment in the comment section down below, and I would love to know the question that you have. The fourth misconception about health at every size is that the aim is to get people who are in larger bodies to engage in health in a better way or to lose a certain amount of weight. And this is completely wrong. First off, health at every size wants to take weight off the table and say this is not about weight at all. This is about treating all people equally and treating all sizes equally. And on a deeper level, it's much more about educating healthcare professionals about their own weight bias and how that might impact the type of treatment and the quality of treatment that they provide for their clients and patients, and helping them to step past this so that they can provide holistic and true, genuine care to everybody equally. It's also about people, regardless of their size, living a more fulfilling life. Yes, maybe that involves engaging in more healthful behaviors, but it also means escaping the sizeism that discriminates against them and is oppressive and really leads to a lot of shame and negativity and guilt and probably more engagement in non-healthful behaviors due to this negative response.
Well, this is a bit complicated because if you've tried everything that people have told you to do and it hasn't worked, you're going to feel defeated, like there's something wrong with you. When actually a lot of the public recommendations, even Weight Watchers, doesn't work for most people. And so the traditional kind of, cut the fat in the diet or just push away from the table, that really doesn't work. And in my clinic, where we focus on the carbs and take away the root cause of the increased blood glucose, increased insulin, and insulin is the fattening hormone, a lot of people will gravitate toward our clinic because nothing else has worked, and it almost miraculously works. And they may have looked for years to try to find something that worked. I wish that we would teach people early on that it's really all about the carbs to have to deal with the weight. It's not the fat. It's not really the amount you eat. You can actually eat more food if you don't eat the carbs in the same way. So I wish there was the common knowledge about carbs being the culprit, but that hasn't been widely taught, and even most doctors don't understand that. And I totally resonate with that weight bias among doctors, that actually weight is worthy of using medications for treatment. That's another bias that doctors typically have. Well, it's just because you're eating too much, it's not worth using a medication. Whereas for high blood pressure, they typically will just write medications. No, obesity is worthy, and now there are many more medications that are available. And so doctors need to kind of get through that. Yes, it is worth to treat, and it is worth using medications. I have a lot of people who come in who want to lose weight, but they don't want to use medications. And I try to explain that, no, it is actually worthy. Problem that using medication can be very helpful as well, although I like to start with lifestyle change. What I teach, actually, I learned from two of my patients who did it in front of me and taught me about it. much like Dr. Unwin, who I interviewed recently on this channel. He's in the UK. One of his patients kind of berated him for not having told her about the approach that helped her, and then now he got converted to using low-carb diets. And so you really don't need a doctor to change the diet, which is another great advantage of using a lifestyle approach to handle this. But certainly we want everyone to feel comfortable in their skin, in their bodies, for self-esteem, for achieving, an entire healthy kind of life and well-being, like she's saying.
Now, some of these misconceptions are quite cruel and actually difficult for me to read, but there is a misconception that health at every size is saying that it's wrong for people in bigger bodies to deserve healthcare. There is this belief in a segment of our society that if a person is in a larger body, they are at fault for that, and that any health needs that they have, which they believe are a result of their weight, which I do not believe that to be true, but that any of their health needs then should be paid for by themselves and not by the government systems, because they have done this to themselves. And quite honestly, I feel like that's a very cruel and, again, incredibly biased approach and perspective to have, but that is not what Health at Every Size is about by any means. Health at Every Size is very much about inclusivity and equal access to healthcare, regardless of your size, with the belief that the more access to healthcare you have, the more likely you are to get the help that you need when you need it, and that medical issues then do not escalate to be something more intense, requiring more medical care.
So in my experience, I've never seen anyone denied care because they were heavy. On the other hand, I'm seeing health organizations deny payment for medications for people who are heavy. Have you tried to get a medication and it's not covered by your insurance company or Medicare or Medicaid? In fact, the state of North Carolina stopped paying for these shots for obesity treatment because it was costing the state so much, and it happened so fast there was very little ability to advocate for people who need the medicine to lose weight. So that is a terrible kind of bias in a way, not the denial of care at the hospital door, but the denial of a medication that has been shown to be safe and effective and FDA approved for obesity. That is a health bias and discrimination there.
Now, you might be thinking this yourself, but another misconception about Health at Every Size is that Health at Every Size is against weight loss. And again, I'm going to repeat it, that Health at Every Size is actually, doesn't want to talk about weight. They take weight off the table as even an important factor at all, saying that all human beings, regardless of their weight and size, deserve the same quality of care and the same, belief of their worthiness. And instead, rather than scrutinizing a person's weight, whether they are larger or smaller, or they lose weight or they gain weight, more so about promoting them engaging with connecting with their bodies and intuitively eating and moving and doing what feels right in a life-enhancing way, than any amount of weight loss or gain that they could ever engage in.
Well, you might be watching this and thinking about your child, your grandchild, that how do you influence and how do you help someone achieve weight loss when even they don't think it's a problem. I've heard it done many different ways. I guess the one take-home point is don't be that kind of person who goes to the reunion or to the family gathering and all you do is talk about weight and how that person needs to, you need to lose weight. And so I don't think that's a great idea. In fact, I hear a lot of stories of people who reacted against their parental focus on weight, and now they're dealing with it later in life. But I've heard other people be given or sent diet books for Christmas. That's another kind of less subtle kind of way, but just to say that, for example, if you've demonstrated by example that a certain lifestyle approach or medication can work, you can just lead by your own example. And that's what typically happens in a lifestyle approach program like I run. It usually takes 6 to 12 months for the other family to kind of notice that something's happened and that it's durable and sustainable. And that's another way to try to get your children or grandchildren to take action about something that they might not think is a problem, and yet you know that there is some risk to having extra weight around on the joints. There is a risk for cardiovascular disease, although small, and just planting the seeds that, if you want to know more about it, I'm here to help you. And I can talk about how I did it. I can refer you to other types of programs, doctors. And a lot of people still don't know that it can actually be easy to get control of your weight. In fact, in the low-carb keto world, we say weight loss is just a byproduct of healthy eating. And that's true. You cut out of all the junk foods, especially if you're young and you're active, the body will start losing weight pretty quickly compared to if you're older and sedentary. It's harder to lose weight.
Now, the final misconception, and I think this is where if you say something enough times, it becomes fact somehow, even if there actually is no scientific proof for it. But that misconception is that if you lose weight, you will see health improvements. And this misconception is that research, even though it's not true, shows that if you lose weight, you will have health improvements. And for this reason, many medical professionals will push weight loss when they're aiming to improve health. However, the research in fact shows that if you engage in healthful behaviors, intuitively moving your body more, paying attention to your hunger and fullness cues, and listening to your satiety, and really recognizing how food feels in your body, and all of these things are very much associated with intuitive eating. I have done quite a few videos on intuitive eating, so I will link the playlist right here if you're interested in watching any of them. However, research shows that the more you engage in healthful behaviors, regardless of the size of your body, regardless of the amount of weight or fat on your body, the more improved your health is. And so Health at Every Size very much encourages and promotes these types of behaviors, or removing the barriers for people so that they can engage in these behaviors and improve their health, rather than putting any focus on a person's weight.
Yeah, your fat store, because your energy balance isn't right. You're taking in more energy than you're expending. And a calorie is not a calorie inside the body, and because calories are handled differently, the carbohydrates are handled differently. So I'm not saying that it's all about calories, but calories do matter. The energy balance matters. But you can clean up your body's metabolism without drawing upon your fat store. And more, well, even now if you're at a plateau, you're on a weight loss journey and you're not drawing upon the fat during that week, or even for some people that month, that's okay. You're following the diet, your metabolism is getting better, and you're keto adapted, you're running on fat better and better. You might not be drawing off your body fat consistently, and that's okay. And the same kind of idea here. Just because you're carrying around extra fat on your body, extra energy, doesn't mean your engine's not purring and running. It doesn't mean you're not feeling well, enjoying life. Totally get it. So in general, I like this approach. I think everyone should be happy and have self-esteem and not be discriminated against by society, either explicitly to your face or behind the scenes. There is health bias against people who carry around extra weight. There's health bias. The medicines aren't being covered to help people with weight loss if they want to. And just be careful if you're trying to influence your family or even your patients. Ask the question, do you want to talk about your weight? If not, move on to a different subject. But just be open to the idea that if you want to talk about it, I'll share what I've done, or link you to resources and other ways that might be more appropriate for your loved one or family member. I hope you find that helpful. If you like, please like, subscribe, and ring the notification bell. I'm putting out new videos on every Wednesday and Friday. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.